I'm Victor Valcour. I'm a professor at UCSF, University of California, San Francisco, and I'm the director of the Global Brain Health Institute. We have a training program called the Atlantic Fellows for Equity in Brain Health. It's an international program, it's interprofessional, and the ideas are really to protect the world's aging populations from threats to brain health. So far we have brought in 119 fellows from 37 different countries, many of them here in Africa. We're in Cairo with Mohammed, who's one of our senior Atlantic Fellows, graduated I think 2 years ago. Also Hani Abram, who's a geriatrician at Enshimes, and we have a fellow currently, a neurologist, Aya Ashur, who's at Enshimes as well. Our goal is that people will network together, work together, try to move the narrative on aging and healthy aging, and particularly around healthy brain aging. I said we are interprofessional, and that means we have artists, we have journalists, we have social scientists, epidemiologists, statisticians, as well as clinicians, neurologists, geriatricians, and we bring them all together, about 30 every year, and they're at one of our 2 founding sites, either in Ireland or in the US, and they spend an entire year together joining forces in this effort and learning from each other while we provide some kind of structure around what dementia means around the world, what are the needs within countries. I think an unusual part of our program is that we train people in policy. Our goal is really to change policies around the world, to understand the challenges that exist within the regions. We learn that from the fellows themselves and the mentors that come from the regions who help them. And then we try to provide some skills around what it means to develop a policy. How do you increase awareness for people around the world? How can you move quality aging in your country? Our fellows come with all kinds of different assets and within their country's gaps. So some of our fellows will come with pretty strong structures within the community they come from, particularly those that are coming from more of the higher income countries. And they're trying to advance the knowledge base sometimes, advance our understanding of dementia, our understanding of prevention. We tend to lean heavily on a public health prevention strategy, so we're very worried about a lot of the non-communicable diseases in midlife. But many of our fellows come from regions where they don't even have basic data. We can't identify the prevalence of the disease. We're leaning on very small studies that are not reflective of the group. And from our standpoint, if you don't know the problem and you don't understand the challenges, and particularly the economic challenges, policymakers are not going to be that interested. They need to know that it's a disease that's important. They need to know the context within the care. They need to know how they can best move their policies forward in a productive way to help. So we try to support those fellows as well, and often the fellows support each other to do that. So we're very keen on being able to support the ability to get that information in places that don't. We're very keen on trying to change narratives. Fellows learn storytelling techniques. We have fellows that train other fellows how to take movies, like the one we're doing today, how to take narratives from caregivers, because those are very powerful narratives, and then you can employ those for good within the regions that you're working in. If we are most successful, we will find that in the years that we run this program, our fellows will keep talking to each other, that the artists from Nigeria will partner with the neuroscientists from Egypt to create the videos to move things forward within that country. And our role will be diminishing over time. In the short term, we provide a lot of guidance. We try to connect people where we can, and we do a lot of networking at the senior level. Program leaders, like the leaders at STRIDE, the leaders of the World Dementia Council, leaders at Alzheimer's Disease International. But over time, we really believe our fellows will be the leaders in this space, and they'll define what we want to do. They'll be the network that makes the difference, and they'll learn best practices from each other and be able to employ them to better their communities.